It takes a couple of minutes to connect it. It's connecting. Okay. Yeah. Good afternoon and namaste, and we welcome all our members, supporters, and the community. It's good to see you on a nice sunny bright day. And Aasha Australia Foundation has been, is, and will be continuing to support our seniors, their families, by keep educating them, serving them, and supporting them in every way. Now, today is the big question is we all worried about, and we all asking that question about COVID vaccine, which is going to be rolling out very soon. We all have a lot of questions. I have myself thinking, what side effects will be? Should I have it with the flu vaccination? Is it going to make me sick? And how I'm going to cope? And today is just the day when you can please listen to Dr. Revunika Rajapakse. We very well thank you for coming in your busy time. And then after the talk, we will have question time. Please keep yourself muted while we have the talk. And then when you put your hand up, we'll have the questions and we'll go on from there. With this, without saying too much, I'm going to ask Dr. Sundar, Rani Sundar. Please, will you please introduce our guest speaker, please? Thank you so much, Rani.
Thank you, Vijender. It's a pleasure to introduce Dr. Revunika Rajapakse to talk to us about the COVID vaccine. Dr. Rajapakse is a medical graduate from Sri Lanka. She graduated in 1995, and then she went on to do advanced training in medical microbiology, and she graduated with an MD in medical microbiology in 2003. She has worked in Sri Lanka, and she has gone on to London to further her studies and gain more experience. And
sorry, you have to unmute yourself, sorry. Oh, Rani, you have to unmute, please. I think I didn't know that.
Can you hear me now?
Yes, we can, sorry.
I'll try again, yeah. Dr. Revunika Rajapakse is a medical graduate from Sri Lanka. Yes, she graduated in 1995 and she went on to do further studies in microbiology. She graduated with a MD in microbiology in 2003. She's gone on to London to gain more experience and more studies, and she worked at the Whipps Cross University Hospital in London. She came to Australia about 12 years ago, and she's currently a microbiologist with the Lavity Pathology in Sydney. She's very well known, and in the process of us trying to find somebody to talk about this COVID vaccine, everyone suggested her name. We believe she has a lot of expertise and knowledge with this about this COVID vaccine. Her interests are in virology, tropical infections, and infection control. I think today we have got a very, very good and knowledgeable person in Dr. Rajapakse to talk to us about the COVID vaccine. We look forward to her clearing a lot of our doubts. Thank you, Dr. Rajapakse. Thank you.
Thank you. And Doctor, I will share your screen now. Okay. So we should be able to share the screen. Yeah, you're on.
Can you see it and can you hear my voice?
Yes, please, we can.
Okay, thank you very much for that kind introduction, and thank you for inviting me to talk to you about COVID vaccine today. As all of you know, Australia is reaching a very significant milestone in controlling this pandemic by rolling out the vaccination program in less than 48 hours. Therefore, I think it's important to each one of you to have a good knowledge and understanding about the vaccines that are going to be used, so that you can gain confidence to go and get it. Okay, so about 15 months ago, we heard the first case of COVID-19 caused by SARS-CoV-2 being reported out of Wuhan in China. However, since then, see what it is today. Globally, there are more than 109 million cases of COVID-19, whereas the deaths have exceeded more than 2.4 million. Now, how to protect yourself and others from this COVID-19? Vaccines are a very important arm of this protection. And the aim of the vaccination is to prevent symptomatic disease, serious disease, and death. The efficacy of the vaccine in preventing virus transmission is not yet known. I'll go into details later on. Therefore, following interventions should be still continued. It's important for us to know this and remember this, still continued even after vaccination. So all of us are quite familiar with these interventions like good hygiene, physical distancing, reducing gatherings, wearing masks when we can't actually socially distance, and adhering to isolation and quarantine when required. Just a brief introduction to the SARS-CoV-2 virus, which is the virus which causes COVID-19 disease. So it's an RNA virus. You can see the RNA is inside the virus here, and it is covered by envelope protein. See, the red ones are the spike proteins. That is the very important part for all the vaccines that have been developed. That is because the spike proteins are the ones actually get attached to the human cells, and that is the one which let the virus into the cell. So when that happens, the infection occurs. Now, what do we try to achieve by vaccination? Once the people receive vaccines, they produce antibodies, and that is B and T cell immunity against the spike proteins. And then what happens if you come across the virus after the vaccination? These antibodies are going to get attached to these spike proteins and prevent the virus getting attached to the human cells, so that thereby the infection is blocked. And that is what we are going to achieve. Now, there are different types of COVID-19 vaccines. There are currently 3 main types of vaccines. All vaccines, as I told you earlier, target the spike protein because that is the culprit. None of these vaccines will give you the COVID-19 disease. That's very important for us to remember. Thank you for inviting me, because that is the culprit.
No, we can't hear that.
Okay. Can you hear me now?
Yeah, we can hear now.
Okay, so out of the 3 main types of COVID-19 vaccines that are available, the mRNA vaccines were the ones which are commonly used world over at the moment, and Pfizer BioNTech vaccine and Moderna are the 2 mRNA vaccines. I will explain to you in detail later. Secondly, the second type of vaccines are the viral vector vaccines. In that category, we have the Oxford AstraZeneca vaccine, which is going to be available in Australia, and Johnson & Johnson also has a COVID-19 vaccine, which is a vector vaccine. And the third category is a protein subunit vaccine. You would have heard sometimes about this Novavax that also has now completed the phase 3 trials. So these are the 3 categories of vaccines which are commonly used. I'll touch on the Pfizer BioNTech vaccine first. So the Pfizer BioNTech vaccine is the first COVID vaccine which received provisional TGA approval. TGA means Therapeutic Goods Administration in Australia, which is the regulatory body. So they approved Pfizer vaccine to be used and gave the provisional approval on 25th of January this year. So it's an mRNA vaccine. What is that? mRNA vaccine means the part of the mRNA which codes for the spike protein is being delivered into our body to produce immunity. Now, mRNA, as I told you earlier, is a very heat sensitive nucleotide. So therefore, you have to protect it by putting it into some kind of vehicle to introduce into our human body. So what the Pfizer BioNTech, the vaccine did was they actually put this mRNA into a lipid nanoparticle, and that is what is there in the vaccine of Pfizer. Now, there are a lot of myths around this because, as you know, this is the first time in the world that we are using mRNA vaccine. Therefore, lots of myths are going around. There is no microchip inside these vaccines. Just to be clear, there is nothing. So there's no tagging or anything like that. And once injected, this mRNA actually does it work. It produces the spike protein inside our cell, and then quickly the mRNA gets destroyed and get cleared away. And mRNA does not get incorporated into the host DNA. So because the RNA is a very heat-sensitive component, major challenge of this Pfizer BioNTech vaccine is storage. It has to be stored in ultra-low temperatures. And the vaccine is provisionally approved to be used in people over 16 and older. And remember, there is no cap on the upper age limit. So anyone 80, 90 years, they can get it. I'll go into a little bit more details later. To achieve immunity, we should receive 2 doses. Each is 0.3 ml given 21 days apart, and it is given intramuscularly into upper part of your arm. Now, with any new vaccines, the main concern is the safety and efficacy. So clinical trials come into play to prove the safety and efficacy of these vaccines. And with the Pfizer vaccine, they did a large clinical trial, and they published the data in New England Journal of Medicine on 31st of December. So it was actually, the clinical trial is an ongoing trial. Still it is going, and they are continuing with it. It is multinational. It is a placebo-controlled, observed blinded. I tell these words because it's actually a very well-planned research work that they did. So more than 40,000 participants were enrolled over 16 years. And they included people with asthma, chronic lung disease, diabetes, blood pressure, and people who are obese. Half of these participants were given the Pfizer vaccine, half were given a placebo, which was a saline, and 2 doses were given 21 days apart. And that is how they looked for the efficacy. So when they looked at the efficacy, the vaccine had 95% efficacy in reducing symptomatic infections after 2 doses. Now, what about the prevention of the transmission? It's still, they are not sure that, I mean, we know there's some kind of prevention against transmission, but the data is being still analyzed. So it is not yet concluded about the prevention of transmission, but prevention of disease is 95%. Now, coming into adverse effects. Look, we are all adults. We have received vaccines when we were children. We can't remember what happened, but we can remember when we gave the vaccines to our children, what happens. They start crying, they get fever, they might not eat or drink for a few days. Similarly, any vaccine has adverse effects, and Pfizer is no different to that. However, these adverse effects are usually mild to moderate in these clinical trials, and they all resolved in the participants of the trials within a few days. And they saw these adverse effects more in younger age groups than the older. What were they? Like, they were local reactions, and these local reactions were similar after first and the second doses. There was no difference. And commonly, there was injection site pain in about more than 80%, and swelling in about 10% or so. And systemic reactions were more frequent after the second dose of the vaccine, and commonly it was fatigue and headache. But some participants actually did complain about muscle pain, joint pain, and some of them also got fever. There were few reported anaphylaxis and allergic reactions not amounting to anaphylaxis, but there were very few. And after this trial, actually, in USA, they did a research. In 10 days, they were looking at 2 million people who were given Pfizer vaccine. And out of 2 million, about 80 got anaphylaxis, and majority of those people were having history of allergy or anaphylaxis. So 80 out of 2 million is less than 0.1%. So it's quite rare. So considering all these data that came out of the clinical trials and the other research, TGA here, they made a statement, and then they said it is not expected that potential for mild adverse effects following immunization will be any significance in the vast majority of individuals vaccinated with the Pfizer-BioNTech vaccine. Now, what about the considerations for special populations? You know, we all have doubts in the elderly. One question that is commonly being asked: can COVID-19 vaccine or Pfizer vaccine be given to frail and elderly? Now, obviously, I mean, clinical trial data data was limited in this age group because there was no people more than 85 frail and elderly who participated in the trial. However, we know this group, this age group is extremely susceptible to impact of the COVID-19 infection. They get severe disease. Therefore, the benefit of the vaccination should be considered against the risk. Think this way, like say in this age group, any medical intervention, maybe knee replacement surgery, maybe bypass surgery, the risks are more. But what do the clinicians do at that point? They weigh the risk against the benefit and decide whether to go ahead or not. So similarly, Pfizer vaccine will be case to case in this age group. And TGA actually has concluded saying that there is no specific risk of vaccination in the elderly patients. So basically it will be case to case in the frail and elderly over 85. What about the patients with comorbidities? This vaccine is recommended for people with comorbidities like hypertension, diabetes, asthma, pulmonary, liver, and kidney disease, or unfortunately people who are living with blood-borne diseases like HIV, hepatitis C, or hepatitis B. So it is all recommended because, again, people with these diseases have a tendency to get severe infection with COVID-19. Then the next category to consider is the immunocompromised. Again, data is limited, but we know immunocompromised patients are also at high risk of getting severe disease. Therefore, there's no, in principle, there's no theoretical risk or safety concerns because remember, this is not a live vaccine. So in immunocompromised patients, we would not give live vaccines, but Pfizer vaccine is not a live vaccine, therefore it is not contraindicated. So basically, COVID vaccine is recommended for immunocompromised patients. They should be counseled before giving it, and they should be protected. What about the children? The Pfizer is not recommended for children under 16 years of age at the moment. This might change in the future, but for present moment, it's not recommended. What about people with COVID-19 history? Again, it is not contraindicated, but they suggest maybe after an PCR positive infection, delay it up to about 6 months. Then about pregnant women. Now, our regulators have put recommendations for this age group in Australia. It is not routinely recommended, but it is not contraindicated. What they say is if a pregnant lady has a high risk of getting infection, maybe they are of high risk because of their comorbidities, like diabetes, blood pressure, heart disease, or maybe they are at high risk of exposure because of their profession that they are doing. Maybe they are borderline workers, border quarantine workers, aged care workers, or so on. So if they have a high risk of getting it, what they say is consider it. But if the pregnant woman is without high risk factors, they may prefer to wait until the pregnancy is over. Breastfeeding, our regulators in Australia, they say breastfeeding women can receive the vaccine and there's no need to stop breastfeeding or either before or after vaccination. For women planning pregnancy, they say they can have the vaccine. Now, hypersensitivity and anaphylaxis, because of those concerns, after the vaccination, everyone will be observed for 15 minutes. And second dose, if there's an event of anaphylaxis, they will not give the second dose. What's the contraindication? Now, this is important to note. If you are having a history of allergy to any component in the vaccine, then the Pfizer vaccine is contraindicated. List of components we can see in when we look at the product details. But one common thing that they saw, the people who developed anaphylaxis in the study that I told you in the USA, they thought it is related to polyethylene glycol or PEG molecules which are in the vaccine. Now, what is polyethylene glycol? It is a known allergen. It is commonly found in medicine and household goods like cosmetics and so on. People who have come in contact with and are allergic know about it. And if there's any history to allergy or anaphylaxis to PEG, then Pfizer or Moderna vaccine should not be given, but AstraZeneca can be given. What are the precautions? Now, if there is any history of immediate allergic reaction to any other vaccine or injectable therapy, it's a precaution, just we need to make a risk assessment. Now, latex, food contact, or allergies or seasonal allergies are not considered to be precautions. And remember, Pfizer BioNTech vaccine does not contain egg. And I have given you a link there. That's a very good site to go through because they actually list all kinds of questions that people have, and they give answers as to if I have, for example, penicillin allergic, can I have it, and so on. So be free to go to that site and look and see for yourselves. Now, Pfizer vaccine, the logistics, it's challenging. Logistics are challenging because we need to store it in ultra low temperatures at -70. So vaccine is arriving in Australia in a specially designed temperature controlled thermal shippers. And once it comes to Australia, we actually store it in -70 refrigerators. Then we can keep it when the vaccine is rolling out. It can be stored in refrigerators for 5 days at 2 to 8 degrees. And on the day of the vaccination, they will dilute the vaccine vials. Each vial contains 6 doses. And once they dilute it, it can be kept at room temperature for about 6 hours. Now, that is all about Pfizer vaccine, the first vaccine that we are getting. And next, I'll touch on Oxford AstraZeneca vaccine. Now, AstraZeneca vaccine is a viral vector vaccine. Now, viral vector vaccine means, now see in this diagram, they use a chimpanzee adenovirus, and they genetically modify it so that it won't replicate inside human body. After modifying it, they actually incorporate the DNA for the spike protein. So they genetically sequence the spike protein and incorporate into the genetically modified chimpanzee adenovirus. Now, adenovirus is the vehicle that carries this DNA part, which codes for the spike protein, into our body in the vaccine. So once that is done, our body produces spike protein, and our immune system recognizes it and produces T and B cell response. Now, this vaccine again does not cause any permanent changes to our cell, and the DNA does not become part of the host DNA. Now, AstraZeneca vaccine is the second vaccine to obtain provisional TGA approval in Australia. They actually gave approval only last week. I think it was 16th Monday. 2 doses, about 0.5 ml each, given 2 weeks apart. 12 weeks apart. It can be given between 4 and 12 weeks apart, but what the recommendation is longer duration, because the clinical trials have proven if the interval between the 2 vaccines is longer, the antibody production is greater. So this vaccine is again given intramuscularly to upper part of your arm. As compared to Pfizer, we don't have challenging logistics in maintaining ultra low temperatures for AstraZeneca vaccine, because it's not heat sensitive. We can actually store it in refrigerators at 2 to 8. And this is the vaccine that will be available in general practitioners or vaccination clinics, and even in Australia in pharmacies in future. Now, again, just as the Pfizer vaccine, safety and efficacy concerns are there with all new vaccines. Similarly, with the AstraZeneca, they did a very large clinical trial and published that in Lancet, one of the prestigious journals in medicine, in January this year. Now, it's again ongoing. The clinical trial is ongoing. It's a blinded, randomized controlled trial. Again, these words are to make you understand it's a very well planned research. The clinical trial was done in UK as well as Brazil and South Africa. They enrolled more than 23,000 participants, Majority were in the age group of 18 to 55. They gave 2 doses within 6 weeks, or actually they gave, some of them actually received at 12 weeks or even 16 weeks due to logistic problems, according to the researchers. And then they looked at the overall efficacy. And they saw 70% efficacy against symptomatic disease, and vaccine proved to have a very good safety profile. And just a word about the efficacy in older groups. There were not very many participants enrolled in these clinical trials over 55 age groups. Although then what they did was, once the vaccine was rolled out into the community, they were looking at the safety profile and efficacy, and the researchers have concluded they have no question about the efficacy in the over 55 compared to other age groups. Now, again, the adverse effects, they were all mild to moderate in severity, usually resolved within few days after vaccination. And again, adverse effects were mild and less frequent after the second dose. Adverse reactions were generally milder and reported less frequently in older adults, which is good, I suppose, when we hear us, because we are either adults or older adults. The most frequently reported adverse effects were injection site tenderness, which is expected, which was seen about more than 60%. Fever and chills were seen in about 30%. Pain at the injection site, headache, fatigue. It's not very different from what we saw in the Pfizer clinical trial. Again, serious adverse effects were very rare. In a clinical trial of more than 23,000 people, there were only 3 serious adverse effects. There were no deaths. All 3 people recovered. Consideration for special population for AstraZeneca vaccine. It is recommended only for 18 years and older, not for the younger than 18 age group. Pregnancy, breastfeeding, and planning pregnancy, that population, no recommendation yet. I'm talking about Australia. We are awaiting update from the Australian Technical Advice Group on immunization, but I suppose the recommendations will be similar to that of Pfizer vaccine, but we are waiting that. Immunocompromised individuals thought to be safe, and people who had COVID, again, they can get the vaccine. At the moment, we are waiting here for the guidelines, but in the UK, they give at least, they keep minimum of 4 weeks after PCR positive when they are giving AstraZeneca for people who had COVID disease. Right, just a word about variants of concerns. We all have heard about this COVID-19 vaccine efficiency against variants. There are lots of doubts around it. Now, what are these variants? I told you the SARS coronavirus 2, which is the causative virus, is RNA virus. And what happens with RNA virus when they multiply? They bound to cause errors. And these errors leads to mutation. Now, majority of these errors are silent errors. Nothing happens to the virus. Some errors actually becomes lethal to the virus, whereas some other errors, when they multiply, they give an advantage to the virus. So then we have this variant virus. So variants of concerns we call. Now, this diagram shows the 3 variants of concerns that are circulating in the world at the moment. The first one in yellow, it was first detected back in September 2020 in the United Kingdom. Now, it was detected in United Kingdom. It does not mean it originated in United Kingdom. Now, what is the advantage that mutation B117 has given this virus? It has given the virus more increased transmissibility, so it can transmit 70% easily compared to the original virus. And there's a thought that there's a possibility of increased severity. UK researchers say about 30% increased severity. But still, there are research going around that. So that B11 mutation has given those two advantages to the virus. But we do not have any concern about this mutation against the efficacy of the vaccine. Then the second mutation in the middle, it was reported from South Africa. It was detected in South Africa. Again, does not mean it originated there. And B1351 mutation has given again advantage to the virus because that mutation again gives it increased transmissibility, but more importantly, possible reduction of vaccine efficacy. Now I'll touch on the other vaccine also and come back to this vaccine efficacy. The third virus mutation was again first detected in Brazil in January 2021. And that mutation again gives the advantage to the virus that it can transmit very easily and possibility of reduction of vaccine efficacy. So these two variants of concerns which were detected in South Africa and Brazil, the question is, will the vaccine work against them? Now, research is again still going ahead. Researchers are looking into it, but what has been proven up to date is there's a reduction in our body, the vaccines protection provided by vaccine against these variants. There's a reduction, but it doesn't mean that the vaccine will not protect against these variants. So there's a reduction, but still there's a protection. So therefore, we still need to continue with vaccination regardless. So we know Australia, we are very concerned about these variants, and we are closely monitoring international developments of variants of concerns. I'm sure in the future there may be some other variants, but we need to understand it intelligently. Now, another question that is being asked commonly is, can efficacy of AstraZeneca and Pfizer vaccines be compared? Because we know in the media day in, day out, they say Pfizer vaccine is 95%, AstraZeneca is 70%. What does it mean? Look, those two clinical trials were not done in the same populations. The participants were different. Therefore, we can't actually directly compare results of these two. But it's always important to remember that lower 70% if we take, it's actually a better result than the best flu vaccine we have, which gives an efficacy of about 50%. And no one in the AstraZeneca Oxford vaccine group, they were hospitalized or became seriously ill after vaccination. So therefore, both Pfizer-BioNTech vaccine and AstraZeneca vaccine have a very good protection against severe illness and death. Right. Now, that said about the vaccines, just I'll quickly go through national rollout phases in Australia. We will be starting 1A next week, this Monday, and it will be given to the people who are at the highest risk of coming into contact with the COVID-19 disease, like quarantine and border workers, frontline health workers, aged care and disability care staff, and aged care and disability care residents. They will start receiving the Pfizer vaccine from next week onwards. And then thereafter, we have phase 1B, where most of our elderly population will be vaccinated, people who are at home, and over 80 will be given. Then people who are at home who are between 70 and 79 will be vaccinated, and so on. So then they go on to 2A, 2B, and 3 phases. And by end of October, Australia is hoping that they could actually vaccinate everyone that they are planning to vaccine. Right, just a word about achieving herd immunity. You may have heard about this word, herd immunity. Now, achieving herd immunity is the ultimate or long-term goal of all these vaccination programs. Now, herd immunity occurs when enough people have developed immunity. Then what happens is virus is less likely to spread from person to person. Few who are not immunized are less likely to come in contact with someone who has the infection. Now, I put this diagram to help you understand this. See, all these green dots are people who are immune. The yellow dots represents people who are not immune. Say people have contraindications, right, genuinely, and they may not be able to get any vaccines. So there will be very few like that. Say an infected person is introduced to that community, the red dot. Vaccine is less likely to spread to a non-immune person. So for us to achieve this herd immunity, majority of the community has to be vaccinated. That means majority has to take the vaccine. Right. Just, sorry. Okay. This slide actually shows vaccine rollout in other countries in the world. We know, although Australia is starting this month, way back in December, many of these countries on top of this graph started vaccinating their population. Israel is actually heading. They actually have vaccinated almost 80 out of 100 people, which is a very, very good coverage. And that is followed by United Arab Emirates and United Kingdom and so on. So we will start seeing Australia also appearing in this graph later on. Just a word about Israel. See, this slide, they say going in the right direction. Why are they highlighting these figures? Now, this light color, light blue color represents 60 and above population, and the dark blue represents 40 to 55 age population who required critical care when Israel actually had the pandemic and there were a lot of infections going on. But however, as you can see here, Israel actually started giving the vaccine to 60 and above first. So many of their 60 and above population, they have received the vaccine now. Now see what has happened since 9th January. The people over 60 requiring critical care has dropped significantly. So it's very likely the vaccine is having a very good impact on preventing critical care in this age group. So I think we are going in the right direction. Okay, so on a brighter note, this slide actually graph was taken from WHO site. It is, they published it on 14th February. See, number of global new cases and deaths reported continued to fall for the last few weeks. We see the graph going down, which is a good sign, right? However, WHO cheers the falling rate of global coronavirus cases, but they are still warning the governments and individuals like us to keep their guard up as the new variants are spreading. So in summary, COVID-19 vaccination is safe and will help protect you from getting COVID-19 infection. And COVID-19 vaccination is an important tool to help stop this pandemic. And extent of vaccine coverage is very important in controlling this pandemic. I showed you how the herd immunity is being built, and it's our turn now. We have to get the vaccine and help stop this pandemic. Thank you very much for listening.
Thank you, Doctor. That was excellent and right. Thank you very much. And I know there are a lot of questions and we'll go through most of them as time comes. I know that some of the questions which may rise could be a lot of people take medication, and I'm sure they'll ask that how does it affect if they have using other medication as well and to have the vaccination. Can you please answer it for?
So I suppose you're referring to medications like antihypertensive,
yeah, whatever the medication.
They are not even a precaution. They are not contraindicated. They can still go ahead and get the vaccine.
Injection to
and Dr. Chawla has been writing on the chat box few of the questions. So maybe we'll start with Dr. Chawla. Can you please unmute yourself and then ask your questions, please, so that we can share your. Yeah, you just have. Yeah, thank you.
Okay. Number one, you have talked about 2 vaccines over here in Australia.
Yes.
And 2 have been developed in India. In fact, one of the names appears to be common, but any studies done of Indian vaccines versus the vaccines going to be used in Australia?
Sorry, can you repeat that question again?
Okay. There are 2 vaccines have been developed in India, and some vaccines are coming in Australia. They are also incidentally 2 in number. Which are the vaccines which are common in 2 countries?
Right. So Oxford AstraZeneca vaccine is produced by Serum Institute in India, as well as it will be produced in Australia as well. So it is the same AstraZeneca vaccine, which is given in UK. There's absolutely no difference quality-wise or efficacy or safety-wise. So it will be the same vaccine.
Okay. And one more.
And I think even Sri Lanka got AstraZeneca vaccine from India, and the name is little different. It's called Covishield, but it's the same AstraZeneca vaccine.
Okay. One is piece of information. First, I'll give you a piece of information and then I'll ask you a question. Piece of information is India has offered the free vaccine to all the UN peacekeeping forces. That's about 200,000 numbers anywhere in their position. There are, I think, 116 positions where this UN peacekeeping force is working, and that's the information. Secondly, a question to you personally. In Australia, there are 2 vaccines available, and you said the results are 70%, 90% success. Given a choice to you, to doctor, which one you will prefer?
I will get whatever is offered to me first.
Okay.
I won't choose. I am happy with both. I am happy with the safety, efficacy, and quality. And whatever the vaccine that I am given first, I'll be first in the line to get it.
Okay. Thank you very much.
Thank you, doctor. And just to on the same issue, I know my family's in States, and only yesterday they said you don't have, when they were not given a choice, whatever was there when number came, you have to take it. So it may happen the same thing
Exactly.
here as well.
Yes, we very likely we will not get a choice unless there's a contraindication. As I told you, like if someone has pig allergy, then Pfizer will be avoided and that person will be given the AstraZeneca. Unless otherwise, I don't think we will have a choice as such.
Thank you, doctor. Poonam has got a hand up. Yes, thank you. You have to unmute, please. I won't say that, but thank you.
Thank you, Vindaji. Just a quick question. I'm not sure if you have already said in that matter what I'm about to ask and stated. I might have missed some not. So how in the graph I've seen you were stating, or it was showing that Israel has covered almost 80%. And so the medication that they have used over there is, out of those two, which one is that, or both they have used?
They used mainly the Pfizer vaccine.
And the result of that, the effect of that, is it effective? Is it working? How would we know which one is more effective and it's working or not?
Both vaccines are similarly effective. So don't have any concerns about that. Pfizer and AstraZeneca are effective in preventing symptomatic disease.
So if whatever we get in Australia or whatever we're getting, either both or one, so we definitely will be, if we go and we want to get vaccinated, then whatever is available, either of the two we will get, and hopefully that will be effective. That's
correct. I think we have to have we should have a lot of faith in our regulatory body, the TGA. They took so long. They were looking at clinical trials. They were looking at how the vaccine is rolled out in other countries, and the response from the community-based vaccination programs. And it's a very, very thorough program that they actually went through before giving provisional approval. So we should not have any concerns unless there is an absolute contraindication.
Just I had the thoughts like these questions in the mind, so to clarify, you have a bit of more clarity. So thought of asking, and plus I suppose as you showed the graph and everything, so I suppose they are giving to those people who are more vulnerable and they need more, and then like people like who have not had these kind of symptoms will come later in the stage, will be given.
That's correct. So 1A, which is commencing on Monday, is to the people who are at highest risk of coming into contact with a person with COVID-19 disease.
Okay, thank you so much.
And also they have also considered high-risk people who will get severe disease if they get it. And that is why they have included people who are in elderly homes.
Thank you, doctor. Is there another question? Please, if anybody's got a question, here is your chance to. Yes or no?
It's not a question, it's a comment. I must personally I must thank the doctor. He has done a wonderful job of explaining.
Absolutely.
And Dr. Rani has brought in a wonderful person, Dr. Rani also. And then Vijender is always good as always.
Oh, thank you so much. And we try to do our best. Thank you, doctor. And Dr. Valanju is there. Dr. Valanju?
Yes.
Yeah. Would you like to please officially thank Dr. please?
Well, thank you very much, Dr. Ravanika, for sharing the.
I had one question, Peter here.
Hello.
Let Dr. Valanju, Peter, please finish, and then I'll come back to you. Thank you, Dr. Valanju. Carry on.
Okay, so thank you for sharing the story of this, the oldest universal struggle or war that we have been facing since the beginning of life. This war started, that is the story of the survival and survival of the fittest. And this has started with life, which started about 4 billion years ago. And it has been going ever since, continuously. So thank you very much for sharing that. It's a fascinating story. You did a very, very good job. You explained everything about the vaccines quite well. You also explained the importance of having the vaccines. And you also tried to explain that no matter which vaccine you take, they are all very, very good, equally effective. And the one that you get quickly is the best one for you. Well, thank you very much.
Thank you, Dr. Renju. We got a question from Peter.
Can you hear me?
Yes,
Of
I
course,
can.
we can see you, we can hear you, absolutely.
Dr. Vanika, my name is Peter Bhatia, and I'm close to 70 years. And thank you very much for your lecture. I've listened everything in detail, but I think the question that I'm going to ask, the point was not mentioned. I would like to know if somebody is on antidepressant like Zoloft or Lexapro for a prolonged period of time, let's say about last 25 years, can he go ahead and take this vaccine?
Yes, it is not a contraindication.
So it is like any other treatment that you are taking with the Lexapro and antidepressant. It's like treated like any other normal medicine.
That's correct. Yes, it may be antidepressant. It may be a antihypertensive drug. You still can get the vaccine.
So we can go ahead and take the vaccine.
Yes.
Thank you very much.
Thank you, Doctor. We've got another question from Sumanji.
Yeah.
Yes.
I'm talking on behalf of Suman. My question is, how will I get to know when my turn is coming up?
They will actually they will give you appointments as it comes. I think I think our vaccine rolling out system is quite good. In fact, my husband is getting the vaccine next Thursday afternoon. He knows exactly when, where he's getting it. And we were told we will be given a date and a time. Similarly, every one of you will be given a date and a time when it comes to your turn.
I'll explain to you, doctor. All GPs will have access to the vaccine.
Yeah.
And once we access to the vaccine, we'll let our patients know the vaccine is ready. And we have different days. The vaccination day, maybe on Saturday, Sunday, we give to them on that particular day, probably 20 patients.
It will all be arranged.
All will be arranged through SMS and informing the patients. Yes. All GPs will give the injection to all the patients. Nobody can miss that. It takes time. Maybe I would say by April, May, June, July, I should have finished all vaccination all over Australia. Maybe some who are coming back from overseas will have the injection till that time.
Thank you, Dr. Sundar.
Got that?
Anybody's got a question? Before I must say that was Dr. That was very good information. Even if I thought, a lot of questions still will be there, because media and different people, everybody's entitled for their viewpoint. One thing is definitely sure, that it cannot be forced. People have a choice, and that's why we have this session, so that you can make informed choices. And that's what it is about. As I said, we do get a lot of people sending the information who are not in favor, but that's the choice they make. And that's for all of you. In the end, it's your decision, your choice, your right. All we can do is we can give you the information and you can select. So before I go, and we give a big applause to Dr. We've got our 4 hubs, the senior groups open on Friday, the 26th. Yeah, let's give a big clap, please.
Thank you.
Thank you.
Well done.
Thank you,
just the housekeeping thing. So on Friday, Hornsby Seniors Hub is open from 11 to 2 o'clock, not very far from the station. Youth and Hornsby Youth and Community Center. Please let us know, because of COVID, even if the numbers have increased, we like to know for catering purpose. We got great program. We got meditation, yoga, Bollywood music, and road safety program is starting. And on 27th, Saturday, Wentworthville is having the seniors meeting, not very far from the station. Wentworth Community Center, 2 Lane Street. We've got meditation, Bollywood Fit, which was very, very popular to make you feel active. We've got another group, road safety program as well, music. We give morning tea, nice lunch, and we've got a very special group coming over. You can take your nice, they will take your nice photos. These are the ladies. They come and form from the soulmates, but we welcome everyone. So please, we look forward to seeing you. And a big virtual concert on the 7th of March, which is Sunday. We've got the best musicians and from India. We set up a stage. We have a proper music and it's going to be streamed live. I'll make a Zoom meeting, but it will be on our page and the Radio Sur Sangam on the YouTube. So these are till now, but a lot of new things are happening. So keep tuned. So we welcome volunteers. We welcome, please become our member. We have tax deductible. We are run completely by volunteers and the goodwill of the community. And we say very proudly that within 2.5 years, we've been able to do much more. So thank you so much. And thank you, Doctor. We look forward to having your support in future as well.
Sure, yes, thank you.
Thank you.
Let's give a big clap now. Thank you. So see you, a lot of you on Saturday and Sunday, please.
यहाँ से भी दोनों स्टेशनों से $10-15 के बीच में आ जाता है।
Angie?